see all the old friends here, as always. I should say, Dr. Shri, this is my 10th conference with you. So I'm very, very happy to be continuing with so much of information, new team members, an extraordinary way going forward. So there's nothing new that I'm teaching here. It's just to make us think out of the box, as Dr. Patana has already told us. I'm here to only add something which we can add take-home message. I always like to take one take-home message if we can go with this extraordinary talks. I know there's too much information piled up into two-day conference. I agree, many of FINMA students came and told me there's so much information, how can we do more? But the take-home messages are the keys, so that's where I'm here with the take-home message today, with the human connection. So I thought about it a lot, what I can bring something new this year. Because we finished everything, every year we come up with something new, so what can I bring something new? So with post-COVID, the COVID times have changed individually all of us, personally, professionally, globally. So that's where I changed me personally as well. And that's where I changed the whole scenario of my practice and the way I look forward in life. And that's where the human connection felt this is the right platform to make us think and to make us, take something home message. So the cure of many diseases is unknown to physicians because they are ignorant of the whole. This came to me before so many years ago. That's why we are integrative physicians here, because we look at the picture as the whole. When we look at the whole picture together, then only we can expect or dream of curing things. When we are integrated also, when we focused on one things, still we'll be missing something. So it's very important for us to look at the whole picture together. Thanks to Dr. Banerjee's extraordinary, information of genes. And yes, we cannot neglect the genes. But this story of this slide takes back to me 20 years ago. When I was in medical school, we were very excited when the genome was supposed to be released in 2003. That was during the medical school only, they were like, so much data coming in. So we thought there is a cure to all the diseases because the genome is going to answer all the questions. But what happened is another thing which exactly, we still had, the puzzles were still missing. So when the sequence in 1953, the discovery of the double helix started, and 2003, the human genome was completely decoded and presented to the world that we will have every answer to every disease. And that's where the whole medical fraternity in the globally, we were excited. But what happened from 2003 to going back all the 2017, we had 75,000 genetic testings available since today. Yes, I have used a lot of genetic testing in my clinic with, testing for simple diabetes also. I started that way, simply testing diabetes also genetically. Okay, back in 2009 only I started genetic testing. But still there was something missing. I was still not happy. It definitely add on, in terms of patients and in terms of everything, but still something was missing for me personally. But the reality that our genes give us relatively little information, for sure, lots of information, but where am I heading this? How is it going to change my practice of medicine, because that's where I am doing this, and how it's going to change my patient or me. This was always a haunting thing for me, Because I would like to give you some examples here. Because genetically, we said, yes, everything is genetically, but then inheriting genetic mutations play a major role in only 5 to 10% of cancers. If you take cancers today, there are only 5 to 10% if we can have genetically born inherited. And all 10% of ALS cases, considered familial and inherited genes of familial ALS. So what happened to the 90% of the cases? Where is the missing puzzle? And less than 1% of Alzheimer's disease are inherited or familiar. Today, if you look at US data, the geriatric population is all about Parkinson's or Alzheimer's. And we did genetic testing for them too. And it was only 1% which was familial. So what is happening to the 90%? Where is the missing puzzle? Genes are regulated and turned off, as we always, we had a lengthy discussion on that. Then again, we came to stress and the diet and the toxins and all that. We had a healthy discussion. Now the genes are over. Then functional medicine came into place for the past 20 years. Then they said it's toxins. Then we started testing toxins. We started testing mercury, lead, whatnot in the blood and the urine. I sent urine samples post-DMSO, pre-DMSO, everything we did. We had a whole full doctor's data channeling that yes, I have exposure to toxins. Then again I said, okay, now I have more answers. But again, I looked at data again. How many people are exposed to toxins? For example, lung cancer. How many people are smokers are having lung cancers? Which is a toxin. So 24% in men and 18.5% in women. But what happened to the other 60% who are getting cancers? So this was always like troubling me. I give lectures, but I'm not happy internally. And I'm still in the journey of learning more. Again, lung cancer, that is the majority of having smoking. And then colon cancer. Then we came the diet part. The diet part, they said it's the meat, it is the frozen meat, it is the processed meat. But when I looked at the colon cancer studies, it is 28% and 20%, which is related to the meat. Then what happened to the rest? It's like something is haunting me inside. That's all I'm here to, kind of maybe speak out loud when something we can't tell it out always. But yes, we always as physicians, we talk to the patients, but at the same time, something is bothering us inside. Again, the Stanford Center for Integrative Medicine, most standard medical textbooks attribute to everywhere 50 to 80% of the disease are stress-related origins. Right? That's what we are talking about, mental health and about stress. And mental health became a very big forte of the name for the past 5 years, and it had more value after COVID. Mental health became a big social media and data with WHO, CDC, everybody also, it became a big thing, right? So we all know 75% of the doctors' visits are due to stress. Now, looking at the stress word only, I am really stressful. It's causing me stress because whenever I tell the patient, it's because of your stress. Am I not having stress? I also have stress. So how am I telling the patient that yes, you have stress, but how am I handling my stress? This is another question again I asked myself, okay, every time I tell it like, what am I doing? How am I integrating? How am I taking care of myself? If I don't take care of myself or the same stress that I'm putting a label on the patient and it is me, then I will be in that same 75% of the diseases, 50 to 80% of the diseases. I will also have the same illness. It's a fact. It's a matter of time. All of us as healthcare providers here, it's a matter of time if we don't take care of ourselves. It's a matter of time we will be in our patient's shoes. And it's just a matter of time that we will be taking the same insulin and we will be taking the same medications that we are prescribing. Now, how do we save ourselves is the only question that I'm trying to ask myself. So again, the mental health, again, genetics, toxins, exposure, then our mental health. So from stress, the word became mental health now. And I'm like, oh my God, this is mental health. New topic came of mental health. I said, okay, let me just explore this world as well at the same time. Now, during medical school, mental health was like, I cannot supposed to be talking something wrong. It was like Like it's as if I can't go to the psychiatric department. If I'm stepping into the psychiatric, that means it's very wrong. That was the story 20 years ago. I cannot tell. I cannot. I grew up in India, so we are like, you cannot talk. Mental health is not a sign of weakness. Okay? Shameful. All in your mind. Always you talk negative. Okay? Something you decide to have, it's all in your head. But then now it's important. It cannot be neglected. Something everybody, and intrinsically linked to probably, physical health. That's where the understanding was, and this is where we are. Now the whole thing changed. We looked at this pathway the whole 2 days, everybody knows that is genes and that is environmental factors and the HPA axis, everything. I know to the T. I can draw this with closing my eyes. Interleukin 6 and cortisol and everything. But still I'm not happy. Again, metabolic syndrome and cardiovascular diseases. So this is what we know by heart in medical school, even though we forget when we put the label on ourselves as integrative physicians, functional medicine, you should know this by heart. You cannot run away from this chart. But then what else? Now the thing down is okay. Now the big box sitting upstairs, which is stress, everything else is down. We know this number one killer. But how? Where? Why? When? Yes, all the W's kept haunting me again. Yes, we know this, but how? How is this a simple stress which is causing all these things? Then this thing came up to me 5 years ago. Unresolved emotional trauma. To the stress word, I got something to, research on. I had something to work on. I said, okay, let me work on this. Emotional trauma can lead to autoimmune disease. There are so many things, right? Sorry. Where am I going? Because I said, if I go one by one, I'll not get anywhere. I said, let me choose one topic, then I will research on it, then I'll come back to that. So I chose autoimmune disorders. Now, autoimmune disorders what are autoimmune disorders? Idiopathic, right? The first diagnosis is idiopathic. I said, okay, let me look at autoimmune disorders, how they are related to the stress. Now, that's why I said, we have more data. Unresolved emotional trauma can lead to autoimmune disease. Now I said, autoimmune disease, adults, if I start looking into it, then again I'll be lost. Why don't we start with children, pediatric patients? Because when you do different kind of training as general medicine and family medicine in US, you are exposed to pediatric patients, gynecology patients, so we see all in all. We are family physicians. Family physicians should know anybody, neonate also, gynecologist also, to geriatric, we are supposed to be family physicians, so we should know all in all. So I'm used to seeing pediatric patients as well, and psychiatric patients, psychological patients as well. So I had enough exposure and a chance to interact with different kinds of patient, age group. Then this kind of, haunts me as children. We always, that kind of shakes us. Because I believe in preventive and regenerative medicine. So that's where my upper training is, prevention and regeneration. If I can prevent something, then I'm making sure that regeneration medicine, I can prevent both sides. So the prevention was the key for me. And I said, prevention, if I can prevent in the children, then there's a whole spectrum of diseases which can happen, right? So that's the same thing. Then again, a childhood trauma lead to addiction. This haunted me more. Why? Because I have children, they are, teenage kids. Addiction became a common next door thing. Forget about stress. Now globally we are connected to addiction. In Indian schools also, the same American schools also, there's no difference. Addiction became common in 7th grade kids. 7th grade kids are coming with addiction. This was like unconsumable for me because my kids are in the same age, They are teenage. I have a 20-year-old and a 16-year-old. Like when they are growing up in 7th, 8th, and my daughter is coming and saying, her friends are vaping. I'm sure some of you know what is vape. Okay? Cigarette smoking is different. Now vaping. I just couldn't take it. I mean, as like 7th grade, kids are vaping. It's an artificial chemical, smoking, which is a new thing all over globally. It's called vaping. Please look into it. We think we are safe, but we are not. Okay, it's a very common thing. Next door in US, it is next door. Every kid is vaping. Okay, it's called, And then in India also, I've seen enough in schools because I give schools, their kids are, it's like because you can't smoke, so they put it in their pocket and start vaping. So this addiction, it just cannot, as a childhood trauma. So all diagnoses that you deal with depression, anxiety, ADHD, bipolar disease, post-traumatic disorders, psychosis, everything is, explanation in the medical term is childhood trauma. If you can explore this childhood trauma personally, professionally, and to patients, we can add a very different wing to the integrative medicine. So when I said autoimmune diseases, this is what we are planning to treat with functional medicine or integrative medicine, right? We are here to treat Crohn's disease, Graves' disease, rheumatoid arthritis, irritable bowel syndrome, and multiple sclerosis. If these diseases are labeled as autoimmune, and if these diseases are related to childhood trauma, then what am I doing? Not addressing this childhood trauma. How am I making a difference? Then the steroids also will not work, nutrition also will not work, chelation also will not work, everything will not work. That's why maybe we are not in the very high peak of curing because it's a whole thing. We have to look at everything. So this is where it says that 70 to 80% increased risk of an adult hospitalization with an autoimmune disorder. And this is what it is. Pregnant mother. Pregnant mother, she might be having trauma. Pregnant mother itself is having autoimmunity, stress, and then she's having a fetus and a child. The fetus having ADHD, depression, anxiety, and everything else. Today, we are all working women. It's standard. If you don't work today, you can't survive. Today, every pregnant woman, you will be working until 9 months of age, which I was also working with my training during pregnancy, but so much of trauma. But looking at our culture here, our culture was always like, you go home at 7 months. So I try to integrate our culture into the science today. So that was a culture. That yes, the mother goes home when she was pregnant. The pregnant woman goes to her child home, mother's home, so that they can relax. This is embedded in our culture, which today is like, no, I'm a very feminist. I can work. I can do anything. I can balance. I can do. I was also like that. No, I have to work. But just imagine how much trauma we are putting to our body, physically, emotionally, mentally, and the child which is coming out. That we are neglecting. A child who has experienced abuse, neglect, disrupt home environment has experienced enough trauma to already have behavioral health needs. This behavior can manifest and improve as depression, anxiety, and aggressive behavior. Now the child doesn't know anything, is not saying that they want to be anxious. So the student with childhood trauma do not have faculty brains. Their mind designed in threatened environment to help them survive. It's all about survivability. As a child, it's there for them to be survive, which is safe survival. For them, I am safe. And then how do I survive? Only they know that much. If the environment is not safe, they cannot survive. Now, signs of unhealed childhood trauma. This is how they present to the clinic. Then we give them label as ADHD, anxiety, depression. But how do they present is what the key is. This could be any of us also. It's not only our patients. This is our personality, how we develop ourselves due to a childhood trauma. We are unconscious, we are not familiar with that. But our programming, the human DNA, the programming which has done due to environmental factors, we tend to be people-pleasing, codependency, fear of abandonment, low self-esteem, low self-worth, okay? Living on high alert, attachment issues, alcohol and drug abuse. This has been studied in and out, and this is scientific evidence-based. I'm not taking from Instagram. Yes, I took some pictures from Instagram and all that, but this is all evidence-based where everything is going this way. So childhood trauma is a key factor to psychopathology. However, little is known. Exposure trauma, again, we are still yet to, a lot of studies needs to be done. Observational human study and experimental animal models suggest childhood exposure to stress can trigger systemic inflammatory response. If everything is inflammation and a childhood trauma can be a systemic inflammatory response, then this is also becoming an add-on to our genetics as well as, toxins. This should be an add-on to our, forte of intern treatments. Hidden wounds of childhood trauma can affect brain development, key behavioral domains, positive valence, negative things, subsequent stresses and psychopathology. And detecting and healing these hidden wounds may help prevent and treat psychopathology emerging after childhood trauma. So this should be part of it, everything. Now there's a new science. Now what, how? Again I told you how, where, when. I needed pathway, I need science, I need which pathway, which part of the brain. We are healthcare professionals. We need to know where, how. Unless and until then we are not convinced. So this is where the term is psychoneuroendocrine immunology. This is how integratedly our brain is. So this is a whole new pathways which have been addressed and published many papers on psychoneuroendocrine pathway. Is a science integration between psychology, neural, endocrine, immunological process, and this is developed in through the discoveries of interaction between human system molecules with neuroendocrine activity. And this is part of the 2018 paper, 18 paper, which has been longevity as part of the longevity research paper as well, which with the neuroendocrine pathway. So the psychoneuroimmunology, before we know 10 years ago it was psychoneuroimmunology, but this is psychoneuroendocrine immunology pathway, nervous system, immune system, endocrine system. So these three systems as well as endocrine institute, how are we going to do it, part of it. Now I said, I want to know where and how, which pathway. I looked into a detail, it's like, I want to know which pathway. Because we know the pituitary pathway, we know ACTH, we know cortisol, we know all the things. I said, which part of the brain that the pituitary is affecting? Which part of the brain? So into my research, I was like, there is a different path of a brain which only stimulates by stress or a childhood trauma, again which indirectly controls the pituitary gland. So that name of this thing is brain is called anterior insular and dorsal anterior cingulate cortex. So there is a different part of the brain which gets stimulated and then integrates into the same pituitary pathway or HPA axis, which we call. A result of physiological recreation, social environmental diversity, then biologically embedded and sustained perceptions of threat for months and years after the original socio-environmental impetus has passed. The trauma is over. It's resolved or not resolved, yet to be questioned. But the trauma is done, childhood trauma is done, but the implications of trauma is still existing in the mind. And the part of the brain which is stimulated and physiological recreation is your interleukin TNF alpha. Now, the cognitive emotional health effects, short term, medium term, and long term. Because we are all humans and we are all, as a living creatures, we all know what is acute stress and we know what is chronic stress. So acute stress, we are all programmed that way because we are for fight and flight response. So acute, we are all flight and fight response. Now my cortisol level is very high. This is an acute response. It's a short-term response. But that short-term response becomes medium term and a long term. Then in the long term, susceptible to infections, inflammatory diseases, accelerating aging, and early mortality. Acute stress, we are all flight and fight. You can't stop that. That is a part of, living life. But which we have to address is the medium term and the long term implications of these. Now the same HP axis, hypercortisolemia, we know all this, bidirectional chronic activation with peripheral lymphocytes, okay? Peripherally in lymphocytes also, again, immune mechanism, low-grade inflammation, memory cells and T cells. So this is PTSD symptomology, which kind of interleukin beta and all that, C activation. So I had to look into it. So social stress, social evacuation, social rejection, social isolation and exclusion. If a child has been rejected or isolated or exclusion, then there is a long-term implication to it. Then this is the part of circular ventricular organs, ACTH, CNS, again the same pathways, which the cytokine producing, macrophages, T cells and the natural killer cells, which is the same pathway. But the brain, the part of the brain which is stimulating is totally different. That's what I want to address here. It's the same thing. Again, I had to cater to COVID again. I said, then what happened in COVID? Because I was like, only the SARS-CoV-2 virus can cause stress. It did not satisfy me. Because as integrated physicians and functional medicine physicians, we know what is COVID and what happened and all that. Directly virus causing stress and anxiety, it did not, satisfy me inside. But there was stress, as somebody was saying yesterday, increasing in mental health problem, including anxiety and depression. Is it the COVID-19 virus causing anxiety and depression, or is something else? How is the virus causing stress and anxiety? But during the pandemic, what happened to all of us? Social isolation and rejection. That's what causes stress and anxiety. I asked why. We can say, yeah, it caused, but why? How? It is the social isolation and rejection. We were just come back. It's like as if we were in the birds were there and the birds were locked up in the cage. Isn't that what we did in pandemic? So what happened to all of us? Or the globe. So social isolation and rejection. This is 2022 paper published in Nature, JAMA, any evidence-based paper that you want. This is 2022 paper, or in fact maybe 2023. Psychological stress, the same area of the mind. Again, afferent nerve, acetylcholine, adrenaline, SARS, COVID, immune response, pro-inflammatory, because we were all testing for interleukin 6. We were all testing for LDH. We were all testing. That was in WhatsApp in 2 weeks only everything came up. We were testing. But why so suddenly? It's a part of an acute response or a chronic response? Or the virus? This is a 2016 paper in Nature magazine. How a childhood trauma, exposure to trauma and response to trauma. In one slide if you want, that is a childhood trauma, acute psychological stress, physical injury, can cause and how they can respond to obesity, substance abuse, poor sleep and psychological pathogens. So potential mechanisms linking childhood trauma and inflammation. Inflammation of this. So again, hidden wounds. It's hidden wounds that of childhood trauma. It's not the childhood trauma alone. The child also, or as an adult also, I don't know what my childhood trauma is. But I will know. It's time that we look at our own childhood traumas which causing me obesity, today my abuse, my drug abuse, my everything. It is important. my childhood trauma, as an adult, everybody's childhood trauma, which is hidden. I'm also not aware. So that is a physical injury. It's, infections and all that. Again, part of the brain function. Again, I said, what are the biochemical pathway which is affecting? That is a structural pathway and a biochemical pathway. So there is a monoamine metabolism and glutamate metabolism which interferes with this stress or childhood trauma. So the monoamine or reduced monoamine synthesis reduces again increased expression of presynaptic transporter, and a glutamate metabolism, increased glutamate response, reduced, and this is an imbalance, you should notice this. Increased expression of presynaptic transporter, reduced expression of presynaptic transporter. That's what I wanted to highlight in this, which is HPXS programming again, and stress and adverse trauma with the microglial reactivity and the microglial priming. So the chemical things, what I want to remember, again, it's a short talk, we cannot go in length, but there is an interference in the monoamine and the glutamate metabolism. And there is a synergy between all of these. And the synergy is that between childhood trauma and inflammation, there is a cross sensitization between childhood trauma and inflammation. So that is a synergy that we need to do. This is 2020 paper that which research started. So there is enough amount of synergy to talk about it. And this is evidence. Specificity, sensitivity, evidence, studied paper, 3 years, 4 years has been studied and proved. 12-year-old members of the E-risk longitudinal twin study has been done. Started in 2008, 2011, and everything is studied, integrated, everything, and this is the specificity of this, of what I'm talking, is elevated in psychiatric patients with a history of childhood trauma, without history of childhood trauma, with history of childhood trauma. Both the groups were studied, and these were the published papers. So children don't get traumatized because they get hurt. Children get traumatized because they are alone with the hurt. Please research this doctor, Gabor Mate, flooded in the YouTube, released extraordinary books. Okay, I'm enrolling with him to learn this pathway. He kind of changed the whole scenario. He's a family physician, palliative care physician, and then he's 75, 80 right now. And then he gave a whole new vision to childhood trauma, healing his own childhood trauma at the age of 70. So he is the author that changed the whole scenario of the doctor, research paper where how a childhood trauma can lead to cancer, to ALS, to multiple sclerosis, and as well as ALS and cancers. So please research on him. Because again, for me, autoimmune was bothering me, and cancers. Now we all know how many cancers we are seeing. What if I tell you that there is another wing to it, that childhood or trauma can lead to cancers as well? Shouldn't be more responsible to it? Are we not responsible addressing this issue? So this is what it is. So, sorry. Again, I'm done. So this is me. I thought I can balance all my life. Okay? Beautifully. I was like, no, nothing, no stress can happen. This is like my own story. I'm balancing here. I keep telling, I go here, I go there. Oh, where is she? Everybody talks about it. And look at the balance that which is needed. Okay? We all do that. This is literally hit me in COVID. Okay, this literally hit me in COVID. I don't know how much I will cry on the stage if I go back to my own story. This is exactly what happened. This is exactly what I thought. I thought I gave up my life to learn how to save yours. Not only my patients, my family, okay, everything. I'm there. I'm there for everything. It's like to-go person. I'm the to-go person for everything. We all do. As you know, we all can relate to this. But initially I thought it was my patients. But it was for family too. But it will really hit you at 40, 45. Okay, that's where I said, enough is enough. I need to look at myself now. Stress, anxiety, and depression can cause when living, again, living to please others. Please. I put every slide with a conscious this thing. Living to please others. Okay? I'm responsible. I am there. That is like it's like I am there. I'm responsible. It's like it's showing me that I'm responsibly taking care. But am I living for others? It's not the stress that kills us, it is our reaction to it. So again I said, what is this causing me imbalance inside? Is it my patience, or is it my work, or is it my, me giving for everything as once? And then when I go back to different clinics, it's like loss of human connection was also bothering me in terms of patient to patient. When you go to the other side of the world of practice, it's all cutthroat. There's no time. You see, 7 minutes, you can't even talk. It's your diagnostics, it's your genetic testing, you give the prescription, you're done. Doctor, the other patient is waiting. The loss of human connection in the AI world, as Dr. Banerjee has said, the future is about AI. So we are losing this human connection in the future of AI at the same time. So it's going to get worse. It's not even started yet with ChatGPT coming in place and artificial intelligence coming in place and everything is coming in place. Is just the beginning of loss of human connection. So we are just in the early phase. So welcome on board. So so people exchanging positive energies. That's why I love to be with Dr. Ushi every time, because of the vibes and because of the energy that she brings in to this conference every time. So I looked at what are the elements of human connection. Everybody says elements of earth, we are made up of 5 elements and all that. That I know. But what are the elements of human connection also is like everything is elements. And what are these elements of human connection? So that's also kind of bothered me in terms of elements of human connection. Eye contact, presence, touch, playful settings are 4 cores of components of human connection. Nobody is doing the eye contact anymore. Okay? We are not present here. I am also in my WhatsApp there once in a while, right? So we are not present. So, and touch. After COVID, there is no touch. There is no playful. So, preventable. Before, this slide was used to be resilience. Okay? This slide of the plant, oh my God, look at that. It's so much of resilient with nothing coming in. So we used to think about this as resilience. But I'm looking at the other side of it right now. It doesn't have a good environment to grow what it deserves to grow. So it will have stunted growth. The growth will be different if the same plant is a different environment. So before I used to look at like resilient, I can do anything. But if my environment is better, the plant would have grown better. So right, it's surviving. But are we here to only survive? Are we here to kind of cherish, live life? So alternative early life stress potentials, that's the whole thing. Again, trauma. Trauma, this is again the same Dr. Gabumate's author. Separation from self, disconnection from others, altered worldview, lifelong pain, cognitive development, personal shame, difficulty being present means reacting to the present, but we're reacting to the past. So why am I not able to be present? Because I'm there, but today's reaction is due to my past trauma. So again, human connection, again, psychology of human connectedness is connectedness. Psychology thought of distinct physical, language, not by language, because we think we can speak, right? Is there anything that human connection without language? Without language, if we can communicate better by touch, hug, feel, I don't need to tell you. I can just look at you and we know each other sometimes. But how many relationships we have that I can just look at you and I can have my relationship with everybody. I can just leave. Do I have to explain it to the other person? So human nature with human connection, a deep sense of love, belonging is irresistible need of all people. We are biological, cognitive, physical, and spiritually wired to love, to be loved, and to belong. When those needs are not met, we don't function as we were meant to. But we may think we want money, power, fame, beauty, eternal youth, car, and all that. But these desires is a need to belong, to be accepted, to connect with others, and to be loved. In a world full of people, what can be more beautiful than knowing how to form healthy relationship, establish deeper connections with those around, to feel socially connected, especially today's increasingly isolated world. This is a long quote that I took from there. So it is your brain oscillate between pumping out of oxytocin and cortisol. We are all cortisol driven. But if we can shift our thing to oxytocin, that is a shift in the change of the hormone that I want to talk about, oxytocin more than cortisol. So it is the game, the mind, it is the game which is a balance between the oxytocin and the cortisol. So it is the brain's betrayal, the intensity, the chemical cocktail. This is the chemical cocktail in the imbalance that goes on versus oxytocin with cortisol. Emotional intelligence, now everything is there. So what do I do? Okay, what happened is happened. I don't have any control on my childhood trauma. Yes, I had a very bad childhood trauma at the same time. But I know I had childhood trauma. But I always thought that I overcame those childhood trauma. But when this emotional thing hit me, my childhood trauma is today's reflection of how I'm reacting to today's stress. It is not about recognizing, it is about accepting my childhood trauma and healing my childhood trauma. I know it's there, but did I ever take time to heal that self is what changed me. So how do I do that? Selfly accepting, willing, understanding, again, ego, thoughts, feeling, brain, all this understanding and keeping them in balance. So unexpressed emotion will never die. They are buried alive and will come forth later in uglier way. They are buried alive. So for me, it was unexpressed emotions of my childhood trauma, which was there, but I would never expressed. But in a very, I'm strong, I can do. It healed, but it never healed. So we may not be responsible for the world that created our minds, but we can take responsibility for the mind with which we create our world. So how do we do it? Repression of emotions. So how do this thing? We are repressing unresolved trauma or grief, inability to say no and establish boundaries. This is what changed. I started saying no. When I say no, it's a no. It took almost 3 to 4 years for me to get there, to say no. Repressing things you can need to say or express, feeling isolated, alone, like no one has your back. Okay, dissociation by regulating negative emotions to the subconscious, outburst of anger and rage, and learned helplessness. So how do we handle emotion? Ignoring emotions leads to depression. We just can't ignore. Fighting emotions, and in suppressed anger in all women is autoimmune disease. So premature aging, due to stress taking care of others, DNA also has been studied under high pressure. Okay, we cannot separate the mind from the body. Denial of all own emotion needs is connection to chronic illness. Sad, afraid, anger. This is what we are, but this is what it's body scan. Okay, this is what we communicate everybody, but we read every day is body scan. This is what we'll end up as. Okay, processing emotion versus hiding emotion. Hiding emotion is busy work. That's what I was doing. I was hiding emotions. I was busy work, 12 to 18 hours, 12 hours a day minimum work. With a family work, it's 18 hours. Okay, unconscious self-denying behavior is learned from infanthood. Okay, so last but not least, if you're caring for others, you must demand support also for yourself. You should demand for yourself for what you want. Okay, so ask yourself and difficulty say no, and lend yourself to others, but give yourself to yourself. Thank you so much.